This is Squirt, a crossbreed ram lamb born with bowed front limbs. At just 11 days old, he was evaluated by Oregon State University's Rural Veterinary Practice Service. The Rural Vet Practice team brought Squirt to the Lois Bates Atchison Veterinary Teaching Hospital for x-rays, where they discovered something unexpected. He had an enlarged heart. The cardiology and imaging teams performed an echocardiogram to investigate further. They diagnosed Squirt with patent ductus arteriosus, also known as PDA. PDA is a condition where a blood vessel fails to close after birth. Dr. Kate Scollan, a board-certified cardiologist at the hospital, explains.
So the ductus arteriosus is a vessel that during fetal life allows blood to shunt past the lungs, since the lungs aren't functioning during fetal life, and then it should close essentially right after either a person or a dog or a cat, or in this case a lamb, right after they're born. It should close, and if it doesn't close, then it allows blood to shunt from the aorta back through the lungs.
This makes the heart work extra hard, causing heart enlargement and potential heart failure. Without intervention, Squirt would likely die within a month. Dr. Scollan and cardiology resident Dr. Charlotte Donnan are experienced with fixing PDAs in dogs. Working with large animal medicine specialist Dr. Kelly Sears and team, who were leading Squirt's care while he was in the hospital, they decided to perform the same procedure to fix Squirt's heart. This procedure has never been reported in a lamb before, likely making it a world's first. To make the surgery possible, Harmony New Beginnings Animal Rescue stepped in to adopt Squirt. Its resources were paired with support from the Aaron and Mary Power Animal Care Fund. This fund provides financial subsidies for animals owned by rescue or sanctuary organizations who require services at the hospital.
Yeah, so we go into the fluoroscopy room. So fluoroscopy is like a movie version of x-rays, so we can watch the heartbeat basically on an x-ray screen. We make a small incision over the femoral artery. So we access the artery, and then we put a long catheter in the artery, go from the leg up into the aorta, and then we pass that catheter from the aorta through this patent ductus arteriosus and go right into the main pulmonary artery, which is carrying the blood to the lungs. And then we advance this plug and kind of extrude one portion, the front half of the plug, in the main pulmonary artery. We kind of pull it backwards until we kind of feel the tension where the smallest portion of that opening is. And then we pull the catheter back farther and deploy the back half of the plug. And so it's kind of sitting, kind of spanning this ductus, and then remains there. Initially, it's attached to a wire, and so that we can kind of push and pull on the wire, make sure that we feel that the fit is good for the size of the plug, for that size of the ductus. And then when we're happy, we can twist the wire from outside of the patient, and then that unattaches it from the plug, and then the plug stays in them forever. And then we take the catheter out of the femoral artery and close up the incision.
After the cardiology team fixed his heart, the large animal medicine team at the hospital fit Squirt with corrective shoes to help his bowed front limbs. Thanks to the dedicated veterinary team and generous support, Squirt now has a chance at a healthy life.